Dr. J.O.C. Samuels, a health systems strengthening expert and Deputy CEO, APIN Public Health Initiatives, joins us tonight on Newsnight. Thank you so much, Doctor, for joining us.
Thank you. Good for having me.
Yeah, I mean, it's interesting to hear the Taraba State governor there saying the last 1 year there's not been any deaths related to COVID. But that's aside. This issue of expired vaccines in Nigeria, about 1 million of them. Yes, vaccines expiring is not peculiar to Nigeria, but should this even be happening at all? Does it raise fundamental questions about Nigeria's readiness and capacity to take delivery of a vaccine surge? I mean, we're hoping to vaccinate 70% of the population by the end of next year. So
I think the way I would like to respond to this, let's take a step backwards and even look at everything in the entirety. Number one, we don't produce vaccines in Nigeria
to start with.
So we are dependent on the manufacturers or the rich countries of the world for them to be merciful and give us what they have. But you also know that all over the world there's competition for these vaccines here and there. So given all of that, we are left with no choice with what we get. And now, what do we get? What we get are most of the time leftovers from the developed world, and these are about to be expired vaccines. Yeah. And I mean, from the little I know about the workings of the primary agency of government that is responsible for that, the National Primary Care Development Agency, when they get these offers, they are excited that, oh, Nigeria, at least we're getting something, we're able to vaccinate our people. Now, most of the time, these vaccines are like 3-4 months expiry. Now, by the time you do all of the negotiations, the paperwork and everything, you have the time you go in, then even the shipping and the eventual arrival in Nigeria, you lose about 4-5 weeks. So you have a shorter time. Now, what that happens, those shorter time you have, is not left on us, so be able to plan all of the logistics to ensure that those don't expire on us. But I also want to go a bit further back to the first set of vaccines that we got.
Yeah.
Did you hear any stories about them expiring or losing them? Because these ones that we are talking about are the ones that supposedly expired in November. So what I know that the MPCAG do is that they start distributing those vaccines, and when it's a week to expiry, they call them back.
Oh,
okay.
They call them back and they send to NAFDAC for destruction.
Oh, all right.
So whether it is up to 1 million, I don't know.
Okay.
But that is the process, because they don't want, or Nigeria doesn't want expired vaccines to be
going into people's hands,
which is dangerous.
So that is what is done. So the issue now is that how do we manage the vaccines that we get?
That's the question.
Okay.
Yes.
How do we manage?
How do we do that?
Is it possible for us to exhaust those doses before they expire?
All right.
Of course it's possible. Back to the first set of vaccines that we got. They didn't expire because I know
in March,
because I got them.
Yeah.
Because I know quite all right that the first set was in March.
Yeah.
The first dose was in March, and they were supposed to expire in July.
Okay.
So
March, April,
what
June,
happened
July,
was that the government tweaked
5 to
the
6
policy and started giving second doses. So that's what happened. Because of those second doses, those vaccines did not expire. People that already got in March or in April were able to get.
All right. Okay. Let me hold you there on pause a little bit. You raised some issues. Now, how has vaccine hesitancy impacted on the expiration of these vaccines? I know that government has been working to create awareness and got people to take this vaccine, but it looks like their best has to be improved upon. What more can they do, and what are they doing now? And of course, the first question, how has hesitancy impacted?
No, the truth of the matter is that we have to do a lot more than what we are doing to ensure that this kind of things don't happen. And vaccine hesitancy is a fact that is happening also that we cannot even deny. And even in developed countries, that is even a major issue. Now we have a population that's only about 3 to 4% are vaccinated.
Yes.
And now we have vaccines that we don't have the control over how many that we get. Now, I think a lot of efforts need to be put in place by government, maybe through the National Orientation Agency or some other, to ensure that communities or culture-specific messages are, because I don't see a lot of those advocacies going on,
especially in the rural areas,
messaging and all of that, to disabuse. It has to be deliberate.
Conspiracies.
It has to be a deliberate effort by government or by all of us to ensure that those conspiracies that you mentioned, COVID-19 misinformation, then vaccine hesitancy, those are major issues that we have to really sit down on the table and plan how to counteract them, either by social media, by traditional, even on this your network, for instance. Like that should be adapted. By the time before you start, there's a messaging towards that everybody get your vaccine. Get your vaccine. So for me, to go back to the issue of expiring, for us to make sure that we don't have vaccines expiring on us, we also took policy. For instance, talk about booster doses, for instance, because vaccine hesitancy is there while you are countering it, but people like us that are ready to take it, you can use us to prevent that expiry from happening, because the vaccine, the volume of vaccine that we have is actually less, or is less than the people that are actually interested in getting it.
Okay,
right. We'll leave it there. That's the much you can take. So many questions, but that's the much we can take. All right. Thank you so much, Dr. J. O.C. Samuels, for being on the program.